And there are some common sleep disorders here, starting with insomnia.
Yeah.
How common is that? You hear about insomnia, but do you really know? Well, you know a lot of people with insomnia.
Well, that's what I say. So I say it very commonly in my practice, obviously, because I'm a sleep specialist. But
right.
If you just looked at the general population, between 9 and 10% of the population has what we call chronic insomnia. That means that it's lasting for more than a month. It's been going on for a long, long time. But it's very common that if you talk to 100 people on the sidewalk, 50% of them would probably say at some time in the last year they had problems with their sleep. So if you look at this little graphic here, this chart, these are the common things we see in my practice, in a sleep specialist practice. We see insomnia. We'll talk about that a little bit later. We talk about sleep apnea, trouble breathing.
We're going to really get into that after the break.
Periodic limb movements. We'll talk about that, and restless leg syndrome. REM sleep behavior disorder. So what that means is you're actually doing things at night that you don't really want to be doing. And instead of dreaming a dream, you actually act out the dream and do something physical that you really don't want to do. And then narcolepsy and hypersomnolence refers to being excessively sleepy during the daytime. So the things that a sleep specialist does is typically what we do is we deal with trouble sleeping at night or being too sleepy during the daytime. So we can see people who say, gee, I can't sleep at night, or I'm gasping or choking, or I can see a pilot, an airline pilot, who says, listen, I've got to see you because I've got to prove that I'm not sleepy during the daytime. Or somebody who's a metro driver or a bus driver and being able to stay awake and alert during the day so they don't have an accident. So we see people with both different phenomena, nighttime and daytime sleep issues.